Welcome back. Thanks for staying with us. The Minister of Public Service and Administration, Inkosi Mzamo Buthelezi, has told the Government Employees Medical Scheme Symposium in Cape Town that the NHI represents a significant step that urges everyone to rethink and reimagine a healthcare system that delivers on the promise of universal health coverage. He spoke to our reporter Lulama Matya on the significance of the NHI in securing a future where there is equal access to healthcare.
About NHI in the context of the theme for this symposium, which is innovation and acceleration access to healthcare. You will understand that NHI, for many people, they mistakenly, they don't see it for what it is, which is to ensure that every person has an access to healthcare services regardless of their financial status or their circumstances, which has not been the case before. So in all honesty, NHI is a very good policy that seeks to ensure that our people can access health services without having to worry much whether they are working or not working because of the disparities that are there in the system. So it tries to bridge the gap between the private sector and the public sector, because we know that more people cannot afford to have access to healthcare services because they are not working with all the other challenges that they are facing. So we seek to bridge that gap and ensure that whether you are working or not, but when you are in desperate need for health services, you must have access to that. And James is strategically positioned to drive that acceleration to make sure that every person has access. If you understand that James is a medical aid that is actually for all public servants and their families, which most of them are very destitute, and we are responsible for a number of public servants who are under the state.
What is government doing to bring on board those who are opposed to NHI?
I think the fact that the President has signed NHI bill into law is quite a progress and a historic, what you call a step towards the right direction, because most of the time people were confusing NHI. I think we have managed as a country, because even those that were opposed, no one in all honesty was opposed to universal health access. It was just some minor modalities as to whether the state will be able to afford that, looking at the corruption that is there, because we know that government has lost trust from many people. So it was issues around the trust that is there, where the capacity of the state will be able to deliver. But the concept and the notion of access, everybody agrees on that one. And since we are in this 7th administration where there is a very positive political will to change things around, we believe that all our odds will be actually overcome and be able to take a new leaf that will take us forward as a country in relation to matters of health access.
That was going to be my next question as to this government of national unity, because some of the parties that are part of the government of national unity, even the IFP, when this bill was presented in Parliament, we were opposed to it, but now things have changed.
No, I think I must correct that. The IFP never opposed the bill itself, because, as I say, all of us collectively, we were unison in terms of access. What was the problem was the modality. Say, for example, if you're talking about access for all, our facilities, now the government facilities, ready to actually absorb the momentum? Do you have enough doctors? Do you have enough nurses? Because in order to kickstart this access for everybody, you must have systems in place. So what we're saying as the IP was that first and foremost, address the issue of infrastructure, address the issue of human resource and everything else slowly, and build up to an ultimate goal of having like access. Because if you look at the private sector, they've got all systems go. They are able to perform and they are able to deliver. When you look at the government systems, they are lagging behind because of a number of things. So that was the argument of the IFP and many others. But now, since we are together under one roof, we are able to use our diverse opinion to make sure that we come to a particular solution, because the interest of the country must be the first and foremost thing that actually occupies us, as opposed to being occupied by all political differences.
And the concerns about corruption on NHI that you were highlighting before, you think think that they will be addressed now that in this current administration?
Corruption should be addressed holistically, not necessarily in relation to matters of health, because the cancer that is taking so much from our country. So the issue of accountability, which is very much emphasized in this administration, and also building the state capacity to make sure that you've got people there who are ethical, and will make sure that when they are entrusted with public purse, they are doing that which the public requires of them. So I think all of us should take a collective responsibility to make sure that we turn the corner in relation to corruption, and we deal decisively with it, because if we continuously going to have corrupt elements within the system, that's going to undermine all our efforts, that's going to undermine all our fortune that we can achieve as a country.